Good afternoon. Today is National Cancer Survivors Day, and all the cancer patients who are surviving uh, after getting treatment and after completion of treatment, rather, and they are living in a normal life and contributing to the country and other their family. They are all survivors, and survivors uh, means they have suffered a lot. They have gone through a very bad time in their life, and they have fought the cancer and defeated the cancer. It is told that cancer is a disease which kills, but in spite of that, rather they have killed the cancer and surviving. Their courage and the is a hard, consistent fighting in each moment of cancer treatment uh, have made them uh, cancer warrior, and they are surviving, and they are leading very good, productive and helping life. Uh, so we should salute them because they are not uh, like us, though many of us suffered from many diseases, but suffering and getting treatment and passing through different stages in cancer management is a really very difficult thing. One thing is that everybody should understand that uh, many cancers now curable. The good thing is that the number of survivors will increase because treatment is now available, and what what are those treatment? At least people should know something about treatment of cancer. Number one, I would speak that if cancer is detected at earliest stage, it is 100% curable. The most of the cancer which occurs is tobacco related, and that happens in your oral cavity, throat, upper GI tract, and a smoke form of tobacco causes cancer lungs and all. Number one, all these conditions, tobacco related cancer, are preventable. So the maximum number of tobacco related cancers are oral cancer, and oral cancer is visible. You can see through your naked eyes by cleaning your mouth properly in front of mirror, and can see is there any ulcer is there any reddish uh, area inside mouth, is there any whitish patch, is there any bleeding from the gum or tongue or base of the tongue, is there any hardness in the oral cavity. So a proper examination of your oral cavity with a good light, torch light, is enough to detect the cancer in early stage, because it is visible, it is outside. And if there is an ulcer which is not healing since last more than 3 weeks in spite of all treatment, if there is a bleeding point which is not stopping, if there is a erosion or erythema uh, or leukoplakia, white patch, uh, and if there is any hardness when you put your finger, washing your hand, touch that area and it is hard, uh, it may be cancer. So whenever you observe this type of symptoms in your oral cavity and you are habitual uh, to tobacco products and all, even though you are not taking tobacco, but whenever you see all these symptoms, immediately you can go to any doctor, maybe in preferably in the cancer hospital or cancer oncologist, and get test done there. And if it is found malignancy, now the good surgeons are there. In early stage, when your lesion is limited to that small area, you can get operated that total mass, and with cancer free zone you can 80% cure. Rest 20% radiation can be given to kill all the micro infiltration surrounding that lesion, and if required, chemo. So now the treatment is given, the combination of treatment is given. With surgery you should take radiation and also the chemo in most of the cases, but surgery is a very important treatment for cancer, where if you have operate or remove that the cancer cell from there and it is not gone to anywhere in your body, you are almost cured. So surgery, any cancer like breast cancer, it happens in form of tumor which is palpable. You can know a woman if regularly palpate her breast by observing those 5 steps: breast self examination in front of mirror during bath once in a month, she can find out the any abnormalities in her breast immediately, whether both the breasts are symmetrically placed, whether some breast has protruded laterally, whether there is more hanging, or the line of lower surface margin is different, if there is mass when you feel your breast in different ways, if there is while squeezing the nipple, if you get bleeding through your nipple, it may be a sign of cancer. If your lymph nodes in axilla and supraclavicle region is enlarged or tender, and the most important thing is mass. Even though you don't have any all these things, you can go immediately to a cancer specialist and get your ultrasound and mammography and biopsy done. And if it is detected a cancer, extensive surgery can be done, removing the entire cancer or tumor from your breast, along with all the lymph node present in axilla and nearby soft tissue, and the entire area is made cancer free zone. Then you can undergo chemotherapy and radiation. So again, the breast cancer, if detected in a very early stage, is 100% curable. Now the radiation. Now very good machine has, earlier the cobalt machine was used when a patient, when he used to take the radiation, he used to suffer from many side effects of radiation: vomiting, reeling head, weight loss, burns, because the radiation not only was killing the cancer cell, but it was also killing the normal cells surrounding to the cancer cell. Now, pinpointed radiation can be administered through very high quality machine, and your normal cell is not affected, only cancer cell is affected, and it kills all the abnormal cell. So in the revolutionary change has happened in the field of radiation oncology through these machines, where the success rate is almost 100%. So radiation, then chemotherapy. Chemo, there are now lot of molecules present, used for treatment of chemotherapy of cancer, which only kills the cancer cell. It doesn't affect the normal cells. It is cancer guided, tumor guided chemotherapy, which kills only the abnormal cells, and normal cells are not being affected. So chemotherapy is also a very advanced science, where lot of medicines have come now which can be administered with minimum side effect. So all this combination of treatment, it's known as adjuvant therapy. Sometimes surgery, after surgery the radiation and the chemotherapy is being given, and this is known as adjuvant. Sometimes if tumor is very enlarged and it is difficult to operate, first radiation and chemo is given, radiochemotherapy is given, neoadjuvant. The tumor size is reduced and then operation is done. But mostly if cancer is in a very early stage, now immunotherapy has come. Very good molecules, immunotherapy, which create antibodies in your body, which kills your antigen, malignant antigen cells in your body wherever they are there. So immunotherapy is an excellent revolution in the field of cancer management. So basically there are 4: surgery, radiation, chemo, immunotherapy, and new molecules are coming, and patients are getting cured with minimum side effect. And that is the reason why the number of survivors now will increase. We need not to worry about whether I will be cured or not. Cure is available now, which were not there just 20 years or 15 years back. But only thing is, you will be 100% cured if your disease is detected in the earliest stage, maybe stage 1 or stage 2, and you are cured. You are a cancer survivor, and after treatment you can lead normal life. It is told that after treatment, if a patient has lived 5 years or more, he is cured. He is considered as a cured cancer patient. Is no more considered as a patient. So need not to worry. Let us, all the scientists are requested to develop or continue doing research. All doctors are requested to advise their patients with minimum expenditure if can be treated, and surgery if can be done in an earlier stage, it is the best. Thank you very much.